The intramuscular injection site commonly used in adults is. The correct option is option D, all of the above. The normal respiratory rate for a newborn is. The correct option is option C, 30 to 60 breaths per minute. Which lung has 3 lobes? The correct option is option B, right lungs. A phobia is classified as. The correct option is option C, anxiety disorder. Osteoporosis primarily affects. The correct option is option A, bone density. The drug of choice for bipolar disorder is. The correct option is option B, lithium. The normal range for serum potassium is. The correct option is option B, 3.5 to 5 mmol. The condition of the soft spots on a baby's skull is known as. The correct option is option A, fontanelle. A common feature of Down syndrome is. The correct option is option B, apicanthal folds. The first dose of the measles vaccine is given at. The correct option is option C, 9 months. What is the major complication of untreated otitis media in children? The correct option is option A, meningitis. The therapeutic effect of a drug means. The correct option is option B, its desired or intended action. A nosocomial infection is one that is. The correct option is option B, acquired in a hospital setting. Melanin is responsible for. The correct option is option B, skin pigmentation. Intravenous injections are primarily used for. The correct option is option B, immediate drug action. The skin plays a major role in. The correct option is option B, temperature regulation. The outermost layer of the skin is. The correct option is option B, epidermis. A child with cough often present with. The correct option is option B, stridor and barking cough. The best position for a patient with hypotension is, the correct option is option A, supine with legs elevated. The hallmark sign of Parkinson's disease is, the correct option is option D, both A and C. The main side effect of antipsychotic medication is, the correct option is option B, extrapyramidal symptoms. The major complication of diabetes insipidus is, the correct option is option B, dehydration. Antibiotics are ineffective against, the correct option is option B, viral infections. A patient with left-sided heart failure commonly experiences, the correct option is option B, pulmonary congestion. Paracetamol is primarily used as a, the correct option is option B, analgesic and antipyretic. Postoperative patients are most at risk for, the correct option is option B, atelectasis. Tuberculosis is caused by, the correct option is option A, Mycobacterium tuberculosis. The most common cause of death in children under 5 years is, the correct option is option D, both A and C. The volume of air exchange during normal breathing is called, the correct option is option B, tidal volume. The most common cause of peptic ulcers is, the correct option is option C, H. pylori infection. The most common route of transmission for HIV is, the correct option is option B, sexual contact. The angle of insertion for a subcutaneous injection is, the correct option is option B, 45 degree. The pleura surrounding the lungs consist of, the correct option is option B, 2-layer. The term effect in mental health refers to, the correct option is option C, emotional expression. A therapeutic communication technique involves, the correct option is option B, reflecting. Which route of drug administration has the fastest absorption? The correct option is option A, intravenous. Which position helps improve breathing in patients with respiratory distress? The correct option is option C, Fowler's. What is the normal range for an adult's respiratory rate? The correct option is option B, 12 to 20 breaths per minute. How often should a patient with an indwelling catheter be monitored for urinary output? The correct option is option A, every 4 hours. In which position should a patient be placed for a rectal temperature measurement? The correct option is option D, Fowler's position. Which of the following is not a typical sign of dehydration? The correct option is option D, edema. Which vitamin is essential for blood clotting? The correct option is option D, vitamin K. Which organ is responsible for producing insulin? The correct option is option B, pancreas. Which of these organs produces bile? The correct option is option C, liver. The nursing process includes the following steps except. The correct option is option C, litigation. Which infection control practice is the most effective in reducing the spread of infections? The correct option is option B, hand washing. Which vital sign is considered abnormal? The correct option is option D, temperature 102 Fahrenheit. In the event of a fire, the nurse should first. The correct option is option D, remove anyone in immediate danger. What is the drug of choice for treating anaphylactic shock? The correct option is option B, epinephrine. Which law or regulation governs the practice of nursing in India? The correct option is option D, Indian Nursing Council Act. Which of the following is a common symptom of hypoglycemia? The correct option is option D, both A and C. Which medication is commonly used to treat hypertension? The correct option is option C, lisinopril. The normal duration of the third stage of labor is. The correct option is option C, 5 to 10 minutes. The best indicator of hydration status in a child is. The correct option is option B, urine output. The target of the National Vector-Borne Disease Control Program is. The correct option is option B, malaria. The first sign of dehydration in an infant is. The correct option is option A, sunken fontanelle.